is DC's transportation hub, Union Station in Northeast DC. Rafael Sanchez Cruz is there now with more information on what you should know to protect yourself. Rafa?
Yeah, that's right, Simone. DC's Department of Health tells us that that person was aboard an Amtrak train that arrived here at Union Station last Wednesday night, March 19th. We want to remind our viewers that measles is spread when an infected person coughs, sneezes, or even breathes. So here's the information that the Department of Health is telling us today. The person was a passenger on the Amtrak Northeast Regional 175 train southbound. We don't know their starting point. They were on the train between 7:30 Wednesday night to 1:30 Thursday early morning. The person arrived at the Amtrak concourse here at Union Station on March 19th between 11 p.m. and 1:30 a.m. And finally, on Saturday night, they visited MedStar Urgent Care in Adams Morgan between 7 p.m. and 11 p.m. DC Health says they're already doing their outreach to contact those who might have been exposed, and they're also asking people to monitor the symptoms you see on your screen there. They could show up 7 to 14 days after exposure. We're talking about a high fever, greater than 101 degrees, a runny nose, watery red eyes, and a cough. Now, the second phase includes a red rash. If you experience any of these symptoms, you're asked to isolate immediately and call DC's Department of Health. Now, in the last hour, I spoke to Elizabeth Choma. She's a nurse practitioner and professor at George Washington University. She tells me the fact that this happened on a train and in close quarters definitely is a factor. Let's listen.
We think of measles as like the textbook, like the most transmissible disease, because it's one of those diseases that will hang around in the air for 2 hours after. So like I'm in a room right now at work, and if we had brought a patient back to this room and they had measles, we would close this room off for at least 2 hours. It really has to do with how likely and susceptible that the person is. If they're not vaccinated and they're in that room with the person, they are very likely to get it. So if you took 10 people and put them in a room with somebody with measles and they didn't have any vaccine against it, 9 will get it. It's very transmissible.
We're seeing a lot of questions about vaccinations. DC Health tells us that if you've never received the measles, mumps, and rubella or MMR vaccine, you are at a higher risk of developing the measles. And of course, there's a greater concern for infants who are younger than 12 months because they're too young to be vaccinated. Now, DC Health is facilitating the process to get people tested and vaccinated. We know it's a lot of information to take in. Luckily, we have all this information up on our website, WUSA9.com. Outside of Union Station, Simone, back to you.
You know, you're generally considered immune to the measles as long as you are up to date on vaccinations. But Rafa, I think you said it perfectly. This is a lot of information to absorb, and I know you're going to continue to follow this story for us. We'll look forward to some of those updates. Thank you.